Live. All right, call this meeting to order. The Sumner County Opioid Abatement Committee at 5:30 Commissioner Klein, would you mind saying an invocation?
Since I'm a short timer, I'll be delighted. Heavenly Father, we thank you for all the good things you bring us. We thank you for our ability to work here in the county for the good of the people, the taxpayers, and to spend well the money that comes from them. Lord, we ask that you will allow us to get through a massive amount of paper this afternoon, and that we will do it effectively and efficiently, but intelligently. And we ask you to help us have good conversations regarding everything that comes up. We ask all this in the name of your Son, Jesus.
Amen. Okay, pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, you have a motion to approve the agenda?
So moved.
Motion by Commissioner Klein, second by Mr. Campbell. All in favor, say aye.
Aye.
Any opposed? A motion for approval of minutes? Motion by Commissioner Jones.
Second.
Second by Commissioner Klein. All in favor, say aye.
Aye.
Any opposed? All right. Recognition of the public. Is there anyone desiring to speak? Wants to sign up? All right. You got it? We'll close recognition of the public. For the committee chairman, Commissioner Jones, no, I'm late, and I have no report from last year. So, for the grant, Justin, it's all yours.
Okay, so tonight we are focusing solely on the presentations, without any scoring or without any awards at this point in time. All of the funds that we have, except for a small amount that we have set aside for potential naloxone or another endeavor, has been advertised. Looking at everything that's coming through, you've read my notes at the beginning of the packets, knowing where the deficiencies are, where some of the strengths are. The packets that have been distributed this evening that is in front of you has either the presentations on it or where somebody has made a modification to their application or submitted supplemental information that is required. So per the terms of the grant application, each applicant will be given 10 minutes to give a presentation followed by a Q&A. I will ask only questions that pertain to either the application itself or the finances so that we have a better and clearer picture, but otherwise than that, the rest of the questions will be up to the committee. Otherwise than that, need to clarify one thing for all parties when it comes to scoring. So, did everybody get the policy for scoring funding availability for grant applications? Just as a reminder, this is the one that was accepted by the County Commission, since we are still not a standalone committee. And the last bullet point says members of the Sumner County Opioid Abatement Committee are required to disclose any financial contributions made to or board service held with any applicant organization. Any member with such a conflict of interest shall recuse themselves from the evaluation and scoring of that application. So when it comes time to score that application, should you be either on the board receiving funds from them, you need to write on that application that you need to recuse yourself. And I did not put a place on there for it. So.
I have a question.
Yes.
What if you sponsored one of their events?
Right now, all it says is are required to disclose any financial contributions made to or board, so you would have to disclose that portion.
So disclosing doesn't mean you can't vote on it, right?
If you look at it, it says any member with such a conflict of interest shall recuse themselves from the evaluation and scoring of the application.
You would be able to, would not be able to vote on that.
Yes.
Different than either contribution or you took money from, you can't.
So if my company sponsored their event, I wouldn't be able to score it, correct?
Absolutely.
According to
Such a small voting group.
Should be adequate. So we will discuss this once all the scores are obtained and you submit your scoring packets. If anything is noted, then we'll be bringing that up at the end of this month, noting it and having a discussion at the end of this month before awards or recommendations to the county commissioner made.
Question, are we going to have another meeting this week or?
Yes. So you do have, I do not have the application in front of me. I believe it's 2 Wednesdays from now is the, meeting,
26?
26 at 5:30, I believe is it. And that is where all the scoring is revealed and where the line will be drawn as far as what we can fully fund and what we could potentially partial fund.
Calendars.
5:30, right? 5:30, yes, sir.
Okay.
That is all underneath the finance report.
All right, old business, grant cycle 4 applications. How would you like to handle that?
So, according, and full disclosure to everybody out front, we were awarding $403,443.61. That is the total maximum amount that we could potentially award. Total funding amount requested is $603,614.98. That gives us a shortfall of $200,171.37. A total of 8 applications were received under the time frame, and that is what we have as far as what has been presented to us.
All right. Yes, please. All right, item 5, new business, grant presentations. Call up one at a time, rate taking recovery. You how many minutes?
Each one gets 10 minutes, followed by Q&A. Regarding Brave Haven Recovery, Brave Haven Recovery is not in attendance. She is actually in Alabama. In your packets, you will find a overview where she has addressed some of the questions, comments, and concerns that we have. I'm sorry, supplemental information, thank you, sir, and everything that they have requested. And so looking at it, they are a new not-for-profit, so they do have 501c3 status. They do not have the financials, so they submitted a comptroller's form. The only questions that we have is how they were going to spend the money, because Brave Haven Recovery itself requested $100,000, but if you were to look at her budget, you can see that her budget exceeds that amount. And so there are questions regarding that amount, because at one point in time, she was requesting funding for the executive director's position in 2 part-times. Then it was executive director's position, and then in the budget that she submitted with the work phases, you see multiple phases for multiple dollar amounts. So that area was quite confusing. But the information that she has provided has been given to you.
All right. Recovery refuge.
I do not see Recovery Refuge in attendance. Okay. Recovery Refuge itself did not submit a complete application. They were missing the comptroller's form and the 990, or the 990 form itself. In addition, there were multiple naming conventions that were not met. And then the last portion of it was, in an email that he had sent, they had used artificial intelligence to combine some of their answers, which caused some reservations.
You covered that in your overview of the packet. All right, well, we'll move on to the Sumner County Health Department. Madam Chair.
I'd also put a note on for Recovery Refuge, they don't meet the SAFE Act either,
Oh, thank you, sir.
to receive state or federal funds.
It's Recovery Refuge.
Doesn't meet the SAFE Act, yeah.
All right, presentation to the Health Department. All right.
Yeah, there's one at the back. On the other side.
Yes,
I got a question. Will, you made a statement. I want to know how you know that, just for public record, since you said that could cause a possible scratch. And I think we should say why, just for the record.
Well, twofold. Number one, it's requested in their application that they submit that, and they did not submit that.
Okay.
2, my organization is one of 2 state organizations that certify recovery housing.
Okay. Certified with the state bank.
Correct.
Only 2 are, okay.
Yes, sir.
one of those states that you said, they aren't. They probably are listening and why it's.
Yeah, no. And that may be why they didn't show up, I don't know.
Good evening, everyone. My name is Charlotte Hollis. This is Lily Miller. You guys may recognize us from the Health Department. We are here tonight on behalf of the Opioid Abatement Committee that we formed 2 years ago. You guys granted us funds to be able to start the substance use navigator program that's at High Point Health. So we're here tonight and this year to ask for additional funding just to help support that program. We're no longer seeking funding for the SUN or the Substance Use Navigator position. We're now actually seeking for some more funding for that. We are currently looking for $54,000, and that's over 2 years, so it's about $23,000 each year. If you guys see up here, we did include it here just for a quick reference to us, and you guys have in your packet the budget that we created, and just highlight the amount that we're spending on each of those items. All of those that are listed are what's included, and we'll go over that here in just a few moments. But just a reminder for those who also may be new to the committee, this coalition consists of the Health Department, the Prevention Coalition, High Point Health at Sumner, and Volunteer Behavioral Health. So we're all still together, still working on this project. So far this year, or since our SUN navigator has been in the position, in the past year, he's been able to decrease overdoses by 24% in total. 33% of the patients that he sees seek recovery treatment. And then he has a referral of more than 430 a year that he was here. So hence, that's why we're asking for more support. The main support we're asking for are two things. One is the box of hope, which is what's given to patients who come to the hospital who are not yet ready to seek recovery or to go into recovery treatment. That box of hope contains, Dylan from Thunder. But again, that just has resources in it that is supposed to help them if they decided at later points that they want to get help or to seek that treatment. The other thing is to apply naloxone. So with our grant from 2 years ago that we received from you all, we were able to purchase 2 vending machines, naloxone vending machines. They are both outdoor vending machines. So there is one stationed at Sumner Prevention Coalition that we just had grant for a month ago, and Volunteer Behavioral Health has been up and running for about a year now. The one at Volunteer Behavioral Health has the most foot traffic and seems to be the most empty, and in fact we have trouble keeping it supplied with the amount of funding that we have left from 2 years ago. Hence we're asking for that. And then the Prevention Coalition, they see a steady decrease is the right phrase, or use of that machine. So again, we're just looking for something to try to keep those full. Part of the reason those are so vital here is that there's not as many sources in Sumner County that have a vending machine that's essentially anonymous that you can walk up to that's for free. At the Health Department, we do provide naloxone, but you have to come in, you have to speak to someone's desk, they have to bring you back to the room, ask you, how many do you need, how to use it, train you, and you can walk out with a brown bag of naloxone. Plus, we're not open 24/7. Those vending machines are accessible 24/7, 365. As long as there's a naloxone box in there, you just punch in how many you would like to have, and it vends what you need. So, just really important that we try to keep those two things stocked. The other naloxone that we're asking for as well, those who put in that box of hope, and again, that's at the hospital, and that's one of the things.
Yeah. So, like Charlotte said, the Substance Use Navigator at High Point Health provides a box of hope for those that do not want to seek recovery at the time. And what is in that box is 2 doses of naloxone. So it's 1 box of naloxone, and it has 2 doses in it. And then the 2 fentanyl and xylazine packs. That's a combination pack. So each pack has the xylazine and the fentanyl test strips. Then we have a few items that are not paid for by this grant. It is resources that are provided to us, and that is the Health Department purchases trifold, Volunteer Behavioral Health purchases trifold, and then we also have 9 and 8 resource magnets. So those sort of things are not bought through the grant. And then we also have QR code magnets that access a community resource guide. That we also provide in a printed format as well. So those are all the things that are provided in the box of code. And then then, as far as tracking goes, naloxone is provided to community partner locations once a month, so that is High Point Health, through the, Boston Post, and then, through the vending machines that we talked about earlier, so the one at Volunteer Behavioral Health and the one at, the Prevention Coalition. And then, the needed quantities, that we estimated were based on the current needs of each location. So like Charlotte said, we have quite a bit of foot traffic with the one at Volunteer Behavioral Health. And then we have, a consistent flow at the one, at the Prevention Coalition. And then we kind of have a consistent flow at the hospital as well. So that was determined based on, those numbers. And then, we buy what we need every month so that we can, not have waste and have, naloxone expire and then it's something that happens. And so we want to be able to use that product and give that product to everyone that needs it. And so, that's, how we do that is through, trying to do that as we need it instead of buying it all at once. That's all we have.
Anybody have any questions?
You have, the health department is supported primarily by the state.
Correct.
And there is contribution by the county. Is there money allocated by either the state or the county for the work that you're doing? To buy the Voxapope or any of the articles in it? So this is all donated or through the opioid abatement?
The box of hope itself, yes.
That's your only way to get it, to pay for it is through this grant.
Essentially. Our partner who provides that said that they might be able to absorb that into their current funding, but that it would be a very tight thing for them to do.
And who is the partner?
Prevention Coalition.
Prevention Coalition, okay. And they're also submitted here, so, okay. All right. That's the only questions I have.
With the vending machine being at behavioral health, what was the decision putting it there with the one being so close to some of the Prevention Coalitions?
It's their main office that gets the most of the traffic between the one that's in Hendersonville and the one that's in Gallatin. And since we partnered so closely with High Point Health last year, 2 years ago, we want to keep that partnership. They stopped it there. And then at the time, too, Prevention Coalition had moved to where they were. Because both of them were the community partners, too, that we had in our grant.
So I know it's like 2 blocks away. Are we going to get any more? Do y'all have any plans getting any more machines? Because I mean, we have 2 machines and they're both a block apart.
No, not currently.
Yeah.
Anybody else have any other questions? Any other questions for y'all? Thank you very much. Thank you. Thanks, baby, for it.
My name is Cam2. We are with the Sumner County Juvenile Court. And we are here to ask you to expand our state-based court rapid rehousing program for our opioid impacted communities. You should have in your packet a presentation.
Give me 1 second. Apologies.
This is Sawyer, and we're going to talk a little bit more about Sawyer here in just a minute. But the theme for the work that we're doing is a child is only as healthy as their family system. We have found that to be extraordinarily true to our work. Next slide. Housing has been one of the most consistent barriers to case progress that we've experienced across the 4+ years that they've been in operation. This committee was gracious enough to fund our existing grant model last year. It allows families to receive up to 12 months of rural assistance, graduated from 100% to 75%, 50% to 25%, and this support can last for up to 3 months at each rate, up to a total of 12 months. Most of our families do not exercise that full 12 months. This allows the family time to prepare for full financial independence without delaying time to a stable, permanent home for our family. It allows our opioid impacted parents to take an intensive level of treatment without risking homelessness. Each family receives a carefully tailored plan to address their needs. And the additional funding that we're requesting tonight will provide additional federal funding for the rental assistance component that we're already doing, but it will also expand our ability to help make these houses and homes for our most vulnerable children. Each of our families is assessed whether they need rental deposits, utility deposits, furniture for the children to return home, and necessary safety items under our current grant. We are asking for an expansion that would allow for furnishings to promote family time, like a dining table and chairs, and therapeutically targeted toys and furniture for children receiving developmental services. We routinely teach families that children have better outcomes when they have meals around the table with their families. But that's not attainable for so many of the folks that we work with. This grant funding will help make that a reality. We help families identify each child's individual developmental needs, whether that's gross motor delays, fine motor delays, emotional regulation issues. And this, we see this across our families, but many of them these issues are most common among the drug-exposed children that we work with. This grant would allow us to help them take the next step by outfitting their home with the toys and tools to help those children overcome those skills. We each have an example in the handout that I've given you of the types of tools that we're talking about to support these families. Next slide, please. Each of our families is screened before they have access to these grant funds. They're required to be impacted by opioid use, of course. They complete an alcohol and drug assessment and are required to be substantially compliant with their treatment recommendations before they can access these funds. They are also required to complete a budget with us that reflects that the family will be able to maintain their full rental amount once FCC exits the program. Next slide. So far, from the initial grant funding that we received, we've spent $23,862.89. The vast majority of that has been rental assistance for 6 families. We did provide a single security deposit in the amount of $800, and then tangible items, including things like beds, mattresses, mattress protectors, to make sure these children have a safe and appropriate place to sleep when they do go home. So far, we've served 6 families with that funding, and the total individuals served are 10 adults and 13 children, which included 1 pregnant mother who actually delivered her new baby this past weekend, so she is now a postpartum mother, and 3 currently postpartum mothers, and we do have a handful of additional mothers who are postpartum when they entered the program, but they've been with us long enough that they now exited the postpartum stage. We also are currently serving 4 children affected by in utero substance exposure with that funding. Next slide, please. I want to show you what happens for a family that receives this support. We have 2 families who started out on sort of a similar path, but who have 2 very different outcomes. This is Sawyer, Tatum, and Penny, and they're the family I'm going to tell you the most about today. But I want to tell you first about a family that we were not able to support with funds like this. They came to us in June of 2024 with drug exposure concerns. Parents were immediately in treatment and graduated before the first month of the program was complete. We had some hiccups and missteps, and then we were able to approve them for therapeutic visitation in March of 2025. Unfortunately, they were shortly thereafter evicted. They were never able to secure housing on their own, and about 5 months later, the state filed to terminate their rental rights. At no point did they secure stable housing, and in February of 2026, the child was surrendered to the state. In June of 2026, she was adopted. Now that's a wonderful outcome, but that child spent 2 years of his young life in foster care, and eventually lost contact with his family of origin. Now I want to tell you about Sawyer's family, because they did receive grant support. They started very similarly, April of 2025, drug exposure. We actually had stops and starts in the beginning, and it took about 5 months before mom was able to complete her inpatient treatment. In November of 2025, she was approved to receive our first round of grant funding. She graduated IOP about 2 weeks later, and we were able to provide gap funding to get her into temporary housing so she was not homeless while we looked for permanent housing for her. We provided that funding through our initial grant from December of 2025 to February of 2026, and in February of 2026, we made our first payment for permanent housing for them. There's a little bit of a discrepancy in the timeline. It says 3/4/26 here. That's actually the date that it reconciled in the financial accounting department, but that was not the date that that check was cut. Within a month of that check being cut, the children were able to attend their first unsupervised visit in a home that we provided. A month later, they were able to spend their first overnight visitation in their home with a bed that we provided. 2 months later, those children were able to move home on a full-time basis, with mom providing full-time care. And we've remained involved for 3 months to make sure that everything is stable. Next week, she'll graduate. You're all invited. Now, this is a wonderful outcome, and we did that with less than $7,500 in resources being devoted to this family. We provided just over $7,000 in rental assistance and $231.98 for a bed and mattress. The one gap that we've identified here for this family, we're not able to provide the dining table and chairs under our current grant. But Sawyer and Tatum also have some big behaviors because they've had a lot of transition in their young life. What we haven't been able to provide for them, while we were able to provide these villages in the home to support them in daycare, we haven't been able to provide sensory regulation tools like sensory beds, kinetic fans, swing, or calming body soft. Now is the time to be building these skills for Tatum and Sawyer. Before they disrupt from daycare, before they go to school and cause disruptions at school, now is the time that we can teach them to do those things. Looking forward, we have 2 new families who have just admitted to have opioid history that would be ideally eligible for this grant. Our most recent involves a 4-year-old drug-exposed nonverbal child who's anticipated to need significant support services. The other child who was admitted had in utero drug exposure. We currently have 10 children receiving early intervention or behavioral health services, and we are asking for the continued ability to provide critical housing support while expanding our ability to tailor each of these homes for the specific therapeutic needs of these children and family as a whole. Thank you for your time this evening, and I hope you'll approve our request to help make these houses into homes that will help our mental vulnerable children.
I have a question. So the first family looked like they were admitted into the program, were not admitted into the program in early 2024. And then they had kind of a failed event. They lost their child, who adopted out. And then the next one they paid $7,500 for the rent, total rent, and
the bed and the mattress.
What else do you guys do to get support for things like that? I know I can buy things in like Habitat, they have furniture and things like that. Do people, are there any, do you reach out to others for that type of things like tables, chairs?
Yeah, absolutely. We partner with all sorts of organizations across the county, the Sumner County Bar Association, Central System Support, Foster Family Assistance Network, Sumner County Process, Ms. Barnes routinely posts on our Facebook page if we have a specific need. The problem is that sometimes we have very specific things that we need. Some of our families are absolutely, happy to have a gently used table or a washing machine that maybe is loud, but it still runs, and we're able to do those things with Habitat for Humanity and lots of different community organizations. But sometimes we have very particularized needs that we can get a lot more quickly if we have funds available to order the things that we need. If we have allergies, if we have restrictions, if we have behavioral support issues. And unfortunately, there are not a lot of places locally that stop development or therapeutics.
And the other thing, do you have specific people that you work with on rent, and, like homes and things like this, or just randomly find rental homes for them?
Ms. Barnes has worked very diligently over the last year to cultivate relationships with, we have some that are private landlords, we have some that are lower income based apartment housing, and we've been able to cultivate those relationships. And now that they know who we are and what we do, and that, hey, they're gonna actually get their money, we're able to coordinate that much more quickly than we were initially, because people are starting to understand what we do.
So are you using, you're going through the state other programs or anything like that? Section 8? We haven't yet.
All of our families are on wait lists for those. Those wait lists are so long that unfortunately many of our cases close before they ever get a phone call from us.
I'm familiar with that. And then the other thing I had was, regarding the toys and the sensory, what other resources do you get for these? I mean, where else do they come from besides boxes, video games?
Cost has occasionally been able to provide some, foster family assistance.
So are they specific type of toys, or are they just toys?
Yeah, they're frequently specific types of toys. Most of our children are receiving early intervention services, and we'll get a treatment plan of the types of things that we should be working on. And they'll give very specific suggestions about a balance ball, or swings, or just a child who needs less sensory input, so needs a kinetic band or something.
Are you coming from social services who are giving you that, those,
Yes.
services, not just.
Yes, we are not just pulling these out of our hands. No, not at all. These are, what we were asking for specifically are the items that support the work that our early intervention specialists are already doing. I see lots of things.
So, I saw on there the 3-month stages of the housing, so it's up to a year of assistance in different varying amounts. What happens after that year? Are they transitioned to a different house, different home?
So far, we have actually not had a family that has requested to go the full 12 months. The family that's getting ready to graduate had at least 8 months of support. And so they will not complete 12 months of service, and they are ready to transition.
Out of that home, or are they?
No, they'll remain in that house. They will pay 100%. And part of that budget process that we do with them is to make sure, we're putting some things back in safe, we're preparing for safe baby work. They know what that model looks like.
And working with them to know what to expect, and the relationship that needs to be there for them if they go through it all.
Yes, and we have monthly team meetings and monthly court hearings to make sure that everybody's on the same page about what those expectations are. We go over them every single month to make sure that the family is preparing.
So these are new homes all the time, that you're finding to build relationships in different manners.
So their work expectations?
Absolutely.
I guess there has to be.
Yeah, they are required to have legal means of income sufficient to support themselves and their children, and that's part of that budgeting process. So you're aware of what else their money is going toward. You're actually seeking currently financial literacy classes for adults as well. That we've been doing some of that informally to make sure that they are ready and they understand the expectations. We do. We've done American Job Center, we've had caseworkers help with resumes, and Barnes is great about making sure they're getting access to vocational training if they need it. This model that's getting ready to graduate is actually now a mentor.
Hard to believe that you could find 100% of the rent, they could take that over after a year with the job they found, rent is very expensive.
And I will tell you, we've had one family here recently that we're working with that we were getting ready to transition to a trial safe house, and they said, hey, we're a little nervous about the finances. And so we sat down with them and we reassessed, and we helped them connect with a higher paying job so that we can continue in that direction. So that is an ongoing conversation with the family that we're continuing to connect with them about.
This particular mother is enrolling in nursing school.
Great.
Pete, you had a question? Go ahead.
So, y'all are requesting 50,000, correct?
40,000.
So 50,000 for the first year. 40,000 for the second year.
Yes, we requested 50,000 last year. We're requesting
40,000 this year, and y'all disclosed everything that the 50,000 went to last year, correct?
Yes.
All right, and then currently you have on your families, you have 9 in Gallatin, 11 Hendersonville, 7 Portland, 2 Westmoreland.
I don't have them right.
No, you're good. I just wanted, so there's nothing in Millersville, Goodlettsville, and then like in the county or in White House.
Right.
Okay, and then, all right, so it's just 40,000. All right. Thank you.
Graduation is next week, is it next Monday?
It's Thursday, August 20th at noon,
August 20th at noon.
in the courthouse,
At the courthouse?
Third floor?
third floor.
Okay.
I think they sent out an email about.
Just so the board is aware and so the public is aware, there was an issue with their applications. So there was one section that had too many characters, so that could, per our directions, could potentially lead them if you decide to disqualify them. The way the worded is worded, it would be up to this board. It doesn't say must be disqualified. It says it's up to you all to decide, number one. Number two, regarding the toys that are being requested, I'm going to need additional information to assist the board. Just looking at the National Opioid Abatement Settlement website, it says some local jurisdictions have permitted funding for sensory rooms or calming tools under broader preventive strategies, early intervention, or co-occurring behavioral health services if tightly linked to substance abuse mitigation. So I would need a study or something to show those points, and then also run that past the state to get their opinion as well, just to make sure that we are not overstepping our boundaries. Because that one's a very tight one. Sorry about that.
No, that's fine, and we would be happy to provide, we have the early intervention reports where NAS is qualifying category for many of our children and the recommendations, so there's some have to provide some of those redacted if that's helpful.
Yes, please.
Okay.
How did you go over the number of character questions? That's my question. Was the application tweaked?
No, the application was not tweaked. When you click the button, the word count and character count is very close to each other, and I just moved the word count, or the word count instead of the character count. It's simple oversight. I apologize for that. I have resubmitted it with the correct number of characters for you.
But the 40,000 isn't just for the sensory toys, correct?
No.
It's for like maybe a kitchen table, a bed, hose form, all that stuff. And all the families that you're serving is tied to Opiod, so. Okay.
Anyone else have questions? Thank you.
Thank you.
When are we going to discuss the scoring of those things? So I'm taking notes on these things that we're saying here and talk about later tonight, and I'll make them.
You will fill out your score sheets. What you think it is, numbering.
Yeah, but with the supplemental information.
You can go back and change.
40,000 is still good.
Okay.
And if you need new sheets, holler at me and I will get some new sheets to deliver them to you.
So like,
Okay.
Page number. I'm so sorry. They're not labeled.
Hang on, honey. I'm sorry.
Is this Cumberland?
Yes.
If you want to ask me something bad about it.
Cumberland Heights.
Yes. Good evening, I'm Amy Liu from Development Coordinator at Cumberland Heights, and this is Leah Reed, Friendship Counselor at Cumberland Heights. Outpatient Recovery Center. And we have some additional information for you. I have your hands up now. We're at the end of our presentation. Okay, the first one is outcomes for Sumner County patients that we have served since 2020. Cumberland Heights has made a lot advancements in the way that we provide treatment in the measurement-based outcome program. And I'll talk about that in a while, but we published an annual outcomes report, and I believe you probably have this in your packet, but there is a printed copy if you would like one of those. There's a nice handy on the back. Inside is like a snapshot of outcomes that might be helpful. So, first of all, we wanted to thank you for your past support. It has made an incredible difference in our patients being able to afford treatment. As you know, treatment is expensive, and so we want to make sure that we're committed to trying to keep treatment affordable and accessible for everyone. And if we could, I also wanted to tell you a little bit about how your continued support will make a difference. So Cumberland Heights has been around a long time. We celebrated our 60th anniversary this summer when it was founded July 25th, 1966. That's when the doors opened. It actually became a nonprofit, was established in 65. But there were few treatment options for people in the Southeast. And in fact, our founder, Bob Crichton, went out to Minnesota to get treatment. And he was so inspired by what he experienced at Hazelden. Y'all are familiar with one of the premier treatment centers in the country. It's now Hazelden Betty's Point. He was so moved by his experience there that he wanted to make treatment accessible to people in Tennessee. And so he modeled Cumberland Heights on Hazelden. And this was our original farmhouse. It has some modifications, but it was original to the property, and it is now named Crichton Hall for our founder's family. So we are modeled as a 12-step treatment program. And when Cumberland Heights opened, it was only for men, and in 1966 we had opened with 3 patients. So Cumberland Heights has grown a lot. All right. Thank you. So today we serve on average 2,500 people a year. We have a big footprint across the state. We're still centrally located in Nashville, and we now have programs where we expanded. The first expansion was for women in 1974, then adolescents, young adults, and we serve people who have substance use disorders and co-occurring mental health disorders. Recognizing that addiction is a family disease, Cumberland Heights was one of the first providers in the Southeast to develop a family program. And we offer that at no additional charge to every person who comes to treatment at Cumberland Heights. Because addiction is, it is a family disease. It affects the entire family. And so we provide education and resources so families can support. For those whose families are willing to come, it's a great resource. So we are trusted care. 60 years is a long time to be around, and we continue to grow and to improve. And Cumberland Heights was the first addiction treatment provider in the state to be certified by the American Society of Addiction Medicine for clinically managed residential services and medically monitored inpatient services. And this is picture of our River Road campus. It looks a little different now. We just opened a new facility for men. They were staying in our 1966 cabins that have been renovated over the years. But best treatment practices now for OUD are combining residential and therapeutic space. So we have been working on this big capital project so that we now have a new space for our men, making a tremendous difference. Also, we are going to be building we started on the project for women, so they can have an equal type of program. And so these certifications, they verify that we provide evidence-based addiction treatment that appropriately matched to our patient's individual needs. Treatment is certainly not a one-size-fits-all. So one thing that's really that Cumberland Heights does, we provide individualized treatment. Every patient who walks through our door gets case management from the beginning and an individualized treatment plan that helps them establish recovery and sustain recovery. So we're going to be with you from when you are perhaps in detox. Some people come to us after they've been in detox, so we have detox services all the way through recovery support. Post-discharge, we provide that as well. So I'm going to turn it over to Leah. You're going to talk about the continuum of care.
The clinical aspect, if you will. So we have medically supervised detox services. We provide residential treatment in Nashville. That's where our hospital is. We have 13 locations for intensive outpatient programs, IOP, one being in Sumner County. We've been there for about 10 years, since 2016. We also offer a 12-step immersion retreat for men and women, which is in the Seagram area, and then of course we have our extended care programs that are on site at our hospital. We have 13 outpatient locations literally across the state. If you look at the back of the pathway, you can see all of those locations. Mainly what's important is in Sumner County, our ROC here in front of the Hunt Club has AA meetings for all community members of Sumner County 7 days a week. We have a large aftercare program at that location. We also have family aftercare, and that aftercare for our patients and family members is free to them for the rest of their life. It's important. We have learned that the closer that you stay attached to the place you got sober, the more sober we stay. The scholarships we are asking you to fund can cover residential and outpatient treatment from recovery, but the OUD requires both. Opiate use disorder changes brain chemistry in ways that persist longer after someone stops using. OUD patients respond well to treatment, but require the right level of care for the right amount of time with ongoing recovery management. Nobody knows that in a week. That's just not the way that works. In addition, residential treatment is where we stabilize people. So what I teach my patients as an IOP counselor is we go to residential treatment to get stabilized, and in IOP is where we learn to live with the disease. Opiate withdrawal is medically serious, and their early weeks of recovery is actually their most dangerous time. That's when the risk of relapse and overdose is the highest. And residential care provides medical supervision, especially when they're at their most vulnerable. 3 decades of addiction medicine has taught us that residential treatment alone is just not enough. Recovery isn't finished in 30 days, and that step down to outpatient care is the real work we're going to say ever happens. People practice recovery skills while living at home, going back to work, and parenting children. That is where we provide that counseling and support, and it is important. I am a resident of Sumner County. My husband and I raise our children in this county. The support to families is vital. Some patients don't need residential care. They can come right into our IOP model, especially if they present on the model their presentation of the disease model. If they have strong family support, they may have a job they just cannot leave. And we consider those our direct admit patients, so instead of going to residential treatment first, they're coming to IOP first. That flexibility matters because it allows us as clinicians to meet people where they are in their recovery process. It increases that engagement for patients because our whole goal is to have a life worth living. Yep, you're okay. So what we are asking you to fund is we're requesting the same amount that we requested last year, $50,000 for patient assistance scholarships to cover residential, I would say, and or IOP, depending on the individual and their needs. And it's 100% for Sumner County residents with OUD who are facing economic hardship to pay for treatment. And
treatment is expensive. Part of the grant application was how much, what is this specifically funding? What is the cost for treatment? For IOP, it's $450 for session, which averages about 17.5 sessions, averages to about $6,600. And then residential, that's the one that's really expensive because it can include detox and residential care, and you are completely, as Leo was saying, when you're in residential treatment, you are away from your environment where you were using, you are learning a whole new way of life, and there is so much support. We have lots of different, I would say, evidence-based therapies that are listed in your grant application, but also we have experiential therapies, we have music therapy, and there is also part of recovery is the spiritual side. We talk about that in our application as well. So healing has to take place in body, mind, and spirit. Last year, your grant, we were able to use all of the funds last year to help 6 Sumner County residents who had need access treatment for OUD. That covered both residential. I know at least one person was in residential treatment, and all the others were IOP. And it was
You've run out of time.
Oh,
Not that I don't like hearing it. Run out of time. Is there someone other?
Let's see. Well, I wanted to show you. So this is a little bit about how this is meeting one of the greatest needs in Sumner County by the Tennessee, SMART Initiative. SMART Initiative Needs Assessment identified 75% of the people responded that treatment, costs were a barrier. So this removes costs, and my last one. Let's see. Sorry about going out of time. This is our why. This is one of our alumni who is doing great now in treatment, and he we have his permission to use a picture, and he was featured actually in an appeal for scholarship. And he says addiction doesn't just affect the individual, it affects the whole family. The hardest things I've done in my life are getting sober and being a father to my daughter, but they're also 2 of the most rewarding things in my life. I never thought I would have a life like this. It's full of love, peace, sincerity, and laughter. I have a beautiful life today with beautiful people in it too. It's all thanks to Cumberland Heights and AA.
Anybody have any questions? I had a question about your spend out on your money
Yes.
last time. How much of that did you utilize?
We used all of it. 100%.
Yeah,
And it
help
helped
6 families.
6 people. Yeah, 6 people and their families. That's right. You help one person, you're helping their family.
Thank you. I didn't hear you.
Oh, yeah, no problem. Any other questions?
It was 6 families, not 6 people, right?
That was 6 individuals, but their families would have all been able to come to family and to the family.
So I have a question. So this sheet that you gave us,
Yes.
72% completed treatment. That's Sumner County only, right?
Yes.
Okay. And then at your location at Hunt Club, is there staff there every day? Like if anybody wants to walk in anytime, what's your hours?
Yes, we have there 4 days a week. We're Monday, Tuesday, Thursday, Friday. We have a morning group. We have an evening group, so depending on the time, 9 to 12 in the morning, 6 to 9 p.m. in the evening.
Do you see more on the telehealth side? Do you see more of an uptake? I have a lot of patients on telehealth.
Yes, we do. We have 2 telehealth groups. I'm transitioning to be the telehealth counselor. I'm going to be based out of Sumner County. And we have a morning telehealth group and an evening telehealth group. We also have family telehealth for family services.
From a financial standpoint, the first go around, Cumberland Heights did not spend all their money.
Right.
Second time, we had to amend your contracts in order to spend down the funds. Looking if this should get awarded for this fiscal year, do you anticipate being drawn down on a quarterly basis, or are you anticipating, what is your drawdown plan?
Right. So it all depends on the qualifying patients that come into treatment. So depending on, it's kind of hard to say, we hope, ideally it'd be great to spread it out over the year. But it all depends on, when people come to treatment. So it's a little hard to give you an exact answer on that, and I realized last year, when we submitted our application the first time, you hadn't received our full invoice, and it has to do with our billing as well, because we bill after the patient completes treatment. So these people because you have to complete the treatment program to get the scholarship. So, that's part of it. So, we maybe would make an exception if there was a, particular situation and someone had to be transferred to somewhere else. But yes, I think it's a little hard when we're anticipating we will be able to. It's made a big difference not having like a per person that we're estimating, or just, having the funds available can help people get the treatment they need when they need it. And it's making a difference in the outcomes. The past 2 years, we have had an increase in people completing their treatment program. And I think that, I don't know if it's causation or correlation, but I think it perhaps is because of having scholarships available. And I wanted to say one thing about that first year. It was our first year doing this program, our first year for scholarships specifically for Sumner County residents with OUD. And we also had it only for IOP, only for outpatient treatment. And so we spent about half the funds, and then the next year we expanded it to residential care, but there were these, like we had added scholars. Normally when someone's asking for a scholarship, we will ask them to fill out a form. And so we removed that because that was a barrier for some folks, and maybe they would be intimidated by that. Also, we had an estimated amount per person that someone would like translated to be a cap. It's not really our intention for it ever to be a cap, but that's how it was worded. And so then we wanted to make sure if someone has a need for $1,000 to go to residential treatment, this grant will allow for that. So, yes.
If they get the scholarship if they complete treatment.
Well, it's not, with the way we bill it, you have to do complete treatment before, I guess it's like, if they have insurance, then they cover all the treatment.
I was just saying, if they don't complete treatment, they receive the bill from the
That's a good question, and I will look into it. I don't think that's been our practice. I think people usually have that intent to complete treatment.
Yeah, some people walk away or something.
Right, I can look into that and see what happens. I do know that if, we have a limited amount of scholarship funds. It's a wonderful thing to be able to provide it, but it is limited. And so if we have someone come to us who has no insurance, no way to pay, and we don't have scholarship funds, we don't turn them away. We will stabilize them and help transition them. We'll refer them to a place where they can be. So we're not going to turn somebody away who can't, not able to.
Anyone else have questions?
I have a couple questions. So I know you said you spent 100% of the funds.
Yes.
I also know that it was maybe our second meeting ago where the amendment come through to do that. You also stated that you don't bill the grant until they complete treatment. That seems like there's a lot of services implemented in a short amount of time there. Just maybe that was a statement and not a question. The second question is, I think Commissioner somewhat alluded to it. These scholarships, if they are a Sumner County resident that is uninsured completely, indigent, would they qualify for that? If I understand right, you would stabilize them at minimum?
Yes, and if they have OUD, yes. And if we have the funds available, yes. It would, absolutely.
I'm sorry, if funds are available, or which one is it?
Well, so for this grant, you are saying, we would, for anyone coming through Cumberland Heights, if we have no scholarship funding available and they have no way to pay, we would stabilize them and refer them to another treatment center where they can receive care. For this grant, you were asking if it's a Sumner County person who comes in with OUD and has no way to pay. Yes, we know that we have the grant funds. I mean, we would certainly funds, but if we don't have grant funds for them, or any way to help pay for their treatment, we would stabilize them and help them go somewhere else.
And one last question too. I know in your amendment that you submitted, you said letters are stigmatizing. I'm a fan of letters here. I see this one actually from the daughter, but
yes.
I just curious why y'all put that in there if they're stigmatizing.
Okay, so this letter was it actually is not this daughter, it was a different person, but we wanted to show, this was a letter from a family member who was grateful that she got her dad back because he went to treatment at Cumberland Heights. So she was not asking for funding for her dad. She was saying it was a gratitude letter. So we're just kind of showing you this is how treatment, it affects the whole family. You gave me my dad back.
Yeah.
So it's a general thank you for Cumberland Heights.
In regard to the contract amendment being offering the service in a short amount of turnaround time, the contract amendment allowed them to actually go back to prior months. So it wasn't picking up right at that point in time. It went back all the way to September, October, and allowed them to pick up some of those people that were in the facility seeking treatment. So it wasn't necessarily at that point in time.
And the way the scholarships work, I'm sorry, our CFO helped me with the application because there were lots of, particular financial things. And that's not my strength. I'll put it out there. But I believe it has something to do with, for people who do have insurance and billing purposes. So we have to find out, what their insurance is going to cover, and then we apply the scholarship. There's a time lag there, and it has to do with that. Also, about insurance, insurance often just covers about 21 days of care, and our program is 30 days. So insurance says you're done at 21 days. Well, you're really not done at 21 days, but we are working with the insurance providers and talking to them to try to get them to extend their coverage. A lot of that is because of our outcomes, and we can show Cumberland Heights, as I said, has done a lot of, we're on the forefront of research, of recovery research, and trying to, help. It helps us inform our treatment decisions. We look at patients, we might talk about this a little bit, too, but in general, we're able to show to research into insurance companies, this is what we do and how we do it, and here are the outcomes for the people that we serve. And we have been successful with our adolescent program. It's actually a 6-month program in extending insurance coverage. Maybe it's not for the full 6 months, but it's for a longer period because of our outcomes. And absolutely.
Because the information is incredible. I mean, if you're asking for 21 days versus 28 days, you have to back that up with their outcomes.
And so we do these measurements while patients are in treatment to see how and you will have in your outcomes, it shows a few of depression, anxiety, and with craving and stuff, but we have a whole host of different outcome measures that we take at specific time points, and our counselors, therapists can adjust treatment accordingly to help each person as part of that individualized care. And we also measure outcomes when people leave Cumberland Heights. Each person who goes to our program is assigned a recovery care advocate who is a certified peer recovery specialist who checks in on them regularly. Full year. Yeah, for the full year. And that's no extra cost. And then, as Leah said, we have our aftercare meetings, or we call them alumni care, but that's in addition to the outpatient facilities offering AA meetings for community. Yes.
So each person that comes or seeks care, it's $6,600?
That's for IOP, the average amount of time people go for different lengths, but that's the average.
So average is $6,600. The $50,000 grant you're requesting, you could potentially help 7 people, but you're also going to use this money to supplement what insurance doesn't pay for families.
Right. So.
That's about factor 6 last year, right?
Right. Yes.
That was about $40,000 and about $10,000.
Right.
But supplementing, that's what I was thinking.
Okay, that was what I was didn't know if it was 7 families.
Anybody else have questions? Thank you.
You're welcome. Thank you.
Some information goes
It's just a single one, so I'm gonna have to stack them up. I don't wanna do that, y'all. We need a little more pictures. This has got pictures on it, so. I can get enough pictures. That's what he's asked. Wait, who?
We have a little project we want to do. We did our, a semi one with our ribbon cutting for Pennsylvania and,
Wait,
so yeah, there's still a little section we're wanting to. Yeah, we've got the sign up saying, you know, you guys help support it, so, yeah, we'll have it all over for sure. Most of you all know us, but I'm Megan, I'm the director of the coalition, this is Josh, he's the project coordinator. I will just start with a brief history of the coalition. We were founded as the Sumner County Anti-Drug Coalition in 2006, and the judges and district attorney were seeing a rise in crimes come through their courtrooms that were associated with alcohol or drug use. But there's got to be a better way to handle this. Let's bring some community partners together and address it on the front end before it gets to the point that we're seeing them in court. So through that, our mission was born to unite people with vision, commitment, and resources to provide solutions that eliminate substance abuse and make a difference for youth, families, and individuals in Sumner County. So for the past 20 years, we've been doing that, and we've grown and sort of adjusted and done it in different ways. But the main thing is always prevention and getting the entire community involved. So I'm going to pass it on to Josh, who's going to sort of highlight the importance of prevention.
Yeah, so we've heard about treatment, recovery, housing, even harm reduction in here tonight. First time mentioning prevention, and so why prevention, and more specifically, why prevention in Sumner County. And I wish the state were a little bit more caught up on the numbers, but this is what we had to deal with. And from 2020 to 2024, Sumner County alone, 338 overdose deaths. So now, thankfully, we've seen a drop in that. I'd like to think it's because of our efforts that we've been doing here, but still a lot of people. And so that is one why. Another one, and this is one we've seen it, this has actually dropped, and that's not a good thing, is the age of initiation of kids using prescription drugs. 11.3 years old, and that came from the student climate survey, the Tennessee Together survey. So that's among, they interviewed, they surveyed 6 through 12 graders here in Sumner County, 12,517 of them. And they returned answers that averaged out to the ones that have used prescription drugs before, or misused them. 11.3 years old is the first time they did it. That's really young, guys. And then also another 338 here. That's the total number. If you do the math, that's the total number of kids in Sumner County that have misused prescription medications. And by the way, I was one of them. If they had taken the survey back then, and if I had been honest, I would have been. And then 28.3% of middle and high school students say that it is easy to get RX drugs or prescription drugs not prescribed to them. So that's the why. That's why we have to work on prevention. And it does work. Prevention does work. There are empirical studies out there that say that it works, that Prevention Alliance of Tennessee has put together some really good stuff. You can look at that stuff if you need to. We've got it. We can provide it to you. But communities that actually effectively address stuff, because not every community addresses these things. But the ones that do, see 44% less prevalence of use among their adolescents. And then communities with funded coalitions, with actually funded coalitions. Now, not every community has funded coalitions, but the ones that actually fund their coalitions see a 19% drop in youth drug use compared to their counterparts that don't have coalitions. So I know we actually border, I think, Robertson County
And so they're trying to get on board and do the same thing. And you can see a gradual and steady decrease in these things over time. We've got some different substances up there. I know this is the Opioid Abatement Committee. We see we've got some different challenges with marijuana right now, particularly because we've got a lot of out-of-state people coming in Tennessee, and the laws aren't the same everywhere. We've got parents that are bringing kids here that may not have been looked at the same way there as it is here. So you're going to see some different numbers here in Sumner County because of that. But opioid use seen a decrease from prevention point. So, and this is the reason it works, because everything that prevention coalitions do is data driven. It's evidence based, and it's not rocket science. I mean, we talk about risk and protective factors, and really, what it boils down to is good will get you good, bad will get you bad. Like I said, it's not rocket science. So in other words, risk factors are, in the terms of substance abuse, the research shows that risk factors for substance abuse increases as risk factors. So what are some risk factors for the reason this stuff is happening? Youth who don't feel like they can talk to their parents and caregivers about their feelings. I was one of them. Now, I love my parents. We have a great relationship now. I was raised in a Christian home. Everything was hunky-dory. But I never felt like I could talk to them about what's going on in my life. That's a risk factor. Families that are isolated or not connected to other people, and that extends to any families. I mean, families look like all kinds of different things, but if they're not connected to other families and being social, that's a risk factor. In other words, red flags, warning signs. Families with negative communication styles. Communities with easy access to drugs and alcohol, and that changes, depending on where you are. We've got different communities here in Sumner County. You're going to see different levels of access. Communities with few activities for young people, that's going to change too. So the way that we mitigate that is protective factors. The good will get you good part. Families who create safe, stable, nurturing relationships, children with positive friendships and peer networks. A whole lot more of that. Children with role models, mentors outside the family, and unfortunately, here in Sumner County, too, right here in Gallatin, there are a lot of kids that have to seek that outside the family because they're not getting it at home. And then families that engage in fun, positive activities together, and communities where families have access to health services. Not going to be the same everywhere. So we can't fix all of it. I mean, we can't, but we can fix some of it. And Megan's going to tell you how.
So, most of the strategies that we engage in for prevention in general, but especially opioid prevention, it incorporates risk and protective factors, trying to decrease risk factors, increase protective factors. And so we do that through a number of different ways, starting with youth education. And you can refer to your sheet here, which will give you a little bit of an idea of how busy that part specifically keeps us. But we use a lot of our time for presentations and things like that to explain coping skills, good decision making, putting the right people around you, and just increasing self-esteem, while also doing direct education of consequences of opioid misuse and really any substance abuse as well. And we also almost always give them keychains, resource guide, let them know how to contact us or anyone if they do need them or a family member needs help. Cam2, part of the Sumner County Sheriff's Office, that is 2 one-week camps. There's a little over 100 kids each week. They go on opposite sides of the county, so it's accessible to all. Everything they get in that is free, and they get all sorts of information, specifically drug prevention information, safe internet practices, good decision making, leadership skills. So those entire camps, Camp Unlimited Potential, those entire camps are built around improving protective factors. Also, because it gives them opportunity, the SROs are actually the ones that are giving these presentations and each have a group in the camp, so they're developing a close relationship with somebody outside of the family that they could turn to should they need them. Parent, caregiver, teacher, coach, etc., any adult that could be in these
with our transparency trailer, which is our mock teen bedroom. Talk security information, which sort of walks parents or caregivers, teachers, through how to have conversations with their children and even specific talking points, and then love and logic classes, which we partner with the schools on now with traditional parenting classes. We partner with a lot of leadership Cam2, leadership Sumner, the school system to do specific substance misuse panels to inform teachers and school nurses and things of that nature of what is going on in the community, resources available, and then our faith forums, because the faith community is huge as well and important in sort of forming these kids' lives through youth groups, community events, things like that. So we try to get the churches involved and informed too through that. So we also have discussed with Sumner County Sheriff's Office a new initiative we want to begin, should we get the funding for it, which is to partner with them to train the members, family members of officers, so that they haven't, those officers that might come into contact with fentanyl or other illicit substances, they have family members that are able to recognize should they start experiencing an overdose, because there was sort of a close call with one officer, and they decided we need family members of these officers, the really any sheriff's office personnel, to be aware of how to recognize it and have naloxone on them as well. Matthew mentioned sort of a gap in availability of naloxone in Hendersonville. We agree, we recognize that as well. We want to partner with Hendersonville businesses to supply them with one boxes, which are mountable boxes. They've got a video screen, a brief training of how to administer naloxone, and then it would have naloxone in there as well. And we've also reached out to Sumner County boxes to see about keeping a couple of naloxone doses in those as well, because they do have several of those in Hendersonville, so that would be sort of a quick way for us to go ahead and get those available to the community. Reduce social access, I told you that. We're just 25% of students think it's easy to get prescription opioids. So we want to make it harder for them. Medication lock boxes, we give those out to the community for free. Anybody that needs one, we give them to daycares, Isaiah House, CASA, foster family, things like that, just to keep anyone that needs them to keep medications locked and safe. Drug take-back days to get any unused or expired medications off those streets, off pouches, and then drug deactivation pouches, which are, you can't wait for one of the two annual drug take-back days. You can stick your medication in these pouches and it deactivates them. And then lastly, just increasing awareness of the resources available in Sumner County. We have a ton of great resources here, a ton of great nonprofits, and we know not everyone is aware of all of them. So through media campaigns, we want to just increase awareness of that, share our resource guide, which we try to keep as all-encompassing as possible. It's 44 pages. We update it as much as we can, and then we also want to turn that into an app so it's even more accessible for people to just quickly pull up an app and find the resources that they may need. And those are resources that are specific to Sumner County as well.
I'm going to keep this really, really quick. So this goes back to the survey done by Prevention Alliance Tennessee. Every dollar invested at the community level, county level, is 12, 18 in taxpayer savings, and they calculated that through reduced burden costs from treatment services, incarceration, food assistance, healthcare, mental health services, and there's some other ones in there too. But just there's a study out there showing that the dollar goes a long way at the county level. It actually goes up further at the county level than it does from state level.
I have a question.
Yes.
When I was at the new place over on Winchester, you guys had a podcast room set up. Is that what you're going to use for your media out, to get out to do more media?
That will not be the only way that will be used, but we do radio ads, billboards, occasionally we'll do the theater, Regal, do theater ads depending on their availability. municipality, CMD ads, actually, we do it all. So there are various routes media-wise.
We just had a couple of kids, and this, one thing that does for us, we don't have to pay people to record PSAs for us anymore. So like last week, we were able to get a couple of kids our interns to record some PSAs that are gonna run in some of these ads, so.
That was used with the money that we gave them.
That was not, the podcast studio equipment was not purchased.
So if you look in y'all's binders here, you know, they have great letters from the Sheriff's Department, Sumner County Schools, Recovery Court, Hendersonville Police Department. I particularly really enjoy the work that they do. They save the county a lot of money, and they save the schools a lot of money from the stuff that they do. I'm very passionate about what they do. They recently had a rodeo, and that's why I asked about the question. My business sponsored a banner. I think it was like $250. So I guess I will not be able to support scoring, but I just want to state how much that they do for this county, and I believe if Sumner Prevention Coalition wasn't here, how much more our jails would be full, how much more work the police would, how much a bigger burden on Recovery Court, a bigger burden on the schools. They haul around a trailer to go to the schools, and another thing that they're doing with the building that we've helped with, I actually went there not too long ago, toured it. They've done a lot of the upgrades already, but they're also being a great neighbor because they're storing Gallatin Police Department's motorcycles in the building. I mean, they don't have to do that, but they are.
They moved the motorcycle.
Okay, well, when I was there, they were storing the police bikes there. They got an impound lot. I mean, this is their property, and they're being a good neighbor. They're just great for our community.
They were there for a long time.
Yeah, I can't,
Well, one other answer to a question you had earlier about the locations of the vending machines. So it just kind of worked out this way that our location has the reason I think we've seen a steady number of people getting it. So we moved in the last part of February.
Right.
The first 12-step meeting, we have 12-step meetings all the time in the back. We've designated a room back there for whoever wants to use it. Since March 1st, we've had a little bit over 1,700 people come to 12-step meetings. Wow. Now, those people are at higher risk. In fact, I know several of them personally who have relapsed, but they're at high risk, and they're walking right by that vending machine. So while I hope they don't have to use it, it's there for them if they do. So.
Right. So just to piggyback off that real quick was the thing, I didn't know that second, because I knew we were talking about a second machine. I didn't know it went to behavioral health. It's just, I would like to see, I don't know who will pay for this or who's going to do it. I would like to see a few more machines, but hopefully the next one isn't a block. I know it just worked out that way, but I want it to be further than a block apart.
We've also talked to a store owner in White House and a store owner in Westmoreland that have expressed interest in that they might be willing to.
And if we got like a store, if someone was willing to pay for the machine and place it somewhere, a business pay for the machine, y'all would manage it and supply it, like the monoxidil, not the machine, like a business pays for it, and y'all would just make sure it stays supplied and all that. If they were willing to pay for the machine for you.
Yeah. Yeah. One of the things that I saw in Florida, it was just at a little shopping center area. It was a red newspaper box, and it had a notice on the front, and it had naloxone in the back, and it was an honor system. And I looked in it, and there was naloxone in it, and wasn't, it was supplied. I think it was the church. There was a addiction church.
Florida. Will, what's the guy that just lost his son? I met him at RX.
Alan Vickers.
Yeah.
We got one in Portland.
Yeah.
Anyway, they have that, and it's been very successful. So that might be an idea in the future, because if you're worried, you want to see them taken up, people don't do that. It's to save lives.
Right.
One of the issues, we into that a little bit. The issue with those specifically in Hendersonville is they have a lot of regulation and codes for what can be outside of a building, which is, yes. So it's, so that's why we had the idea of the one box system. They're already there. They're already existing. If we can stick a couple in there, like I said, we've reached out to them, haven't heard back yet, but, yeah, other communities are open to that. Hendersonville specific, they've got very specific. You gotta find a business willing to do it, and then a bunch of other regulations.
Just a question, those 338 overdose deaths, are those all children under the age of 18 or these adults?
No, that's every age, just every age.
Because most of the presentation focused on.
Sorry,
yeah. And you, so I wasn't sure.
So that's exactly it.
Do you know what the breakdown is of children under the age of 18 or those deaths? You gotta have that handy. I don't know if they give us those numbers. I'd be curious to know that. And I was curious about that.
You had mentioned Cam2, and I was wondering what drives, invites, entices, forces kids to go to these events or camps or.
So Cam2 is done in a way that SROs at specific schools sort of identify kids that would benefit the most from it, and those kids are encouraged to apply.
What about all the other events, like the driving, one by one?
So any of the like impaired driving cards, those are at schools. Those are teachers that reach out to us. It's sometimes health, sometimes criminal justice. So those are the impaired driving are usually at schools, but we do those like at Cam2 as well. This is potential camp, celebrating families.
So most of these things are targeting a group of kids that have been pre-identified by something, right?
Yeah.
Okay.
Yeah. Well, the classes are, yeah, that is.
SROs, a class.
Yeah.
Yeah, a lot of them come through the social health programs, and so they have, in their curriculum, they have a couple of weeks of worth of substance abuse lessons, and it's usually that, so,
Like
yeah.
the Thrive 3 and Respond classes, those are students that have actually been caught with substance, yeah.
350 pounds collected on the 2 drug take-back days. Are those in schools or is that just adults and kids?
That's just in the community. So lately, the location sites have mostly been at pretty much all the Sumner County Krogers, and then like
these are
in
people
West
turning in expired medications, etc.
just cleaning out their medicine cabinets to get it out of their house.
Are they advertised on Facebook?
They are. Facebook, billboards, we try to get the word out.
I probably have 800 now.
Yeah. Well, the next one will be in October.
Every angle we October.
If this is awarded, how soon would you be able to work with the businesses regarding the one box, especially with Hendersonville being in one of our hot zones?
I mean, as soon as a business is ready, we're ready. Like I said, we've already reached out to the Blessing Box people. We're waiting to hear back from them, but that could be something that would be pretty immediate too.
Have you gone to trauma meetings to address the shortcomings that their sign ordinance has that prevents this from happening? Because that may be the avenue you need to take.
Yeah. We have not.
Amendments in there,
Yeah.
I mean, that's a.
Well, they recently, you just sent an article.
Recently,
They waived some.
yeah.
So I was like, I couldn't believe when I read the article. Like, there's an ordinance for this? They
Yeah.
asked them to do like a this little thing?
Yeah.
That was pretty goofy.
So it may fall under that waiving of that ordinance that they have recently taken up. I guess we would need clarification on it, so.
I would advise them to go to.
Yeah.
And all of them.
Yeah, we've lost many signs in
Yeah.
Springfield, even with the proper sign permit. It still takes them up.
They'll take them.
Well, is that all you have?
That's all we've got.
Well, thank you.
Okay.
So next is Hope Family Health over here.
Hope Family Health?
Yes, Edmund. There you go, so you have a handout.
I have a PowerPoint, and I apologize that you just have to Little bit where we are, Hope is different from the other places in that we're a medical clinic. We have a lot of different services. We have 2 locations in Sumner County and 1 in Macon. We were founded in 2005. Our founder specifically started it as a place where because she had an experience as a young woman, as a student, where she and her parents and brothers were turned away for a physical exam for their school year because they did not have the money to pay up front. And so when she got into healthcare, she determined that she was going to found a place that would not turn anyone away for inability to pay. And so Hope has grown over the years. From 2005, we've been in existence now for about 21 years. We got a behavioral health department in 2014. And 9 years later, we opened a facility here in Gallatin. And the facility in Gallatin has both primary medical and behavioral health services. Part of that is substance abuse counseling. It is not our sole focus in our behavioral health, but it is one. We had dreamed, we had talked about, we had an employee at one time whose brother in Michigan knew a public health vending machine, and it was the first I had ever heard of a public health vending machine. So when the opportunity came to apply for the grants with the state Opiod Abatement Council, that was what we looked at. And we initially had thought that we would purchase 6 of those and put them in 6 locations with Narcan and fentanyl test strips. And we also wanted to purchase the Dispose RX package, not to distribute it publicly so much as for our pharmacy to be able to hand out when they have an opioid prescription that they fill to do that. Over time, so we wound up putting out 3 vending machines. We ran into an issue with Freddie Dubois, who was our building and facilities manager, and he is a program manager, found that there were some issues with maintenance, climate control, space, electricity needed, and it didn't take us too long before we pivoted from very expensive, very big vending machines, very heavy vending machines, to like little cabinets about the size of a dorm refrigerator that you just open the door, or even just a countertop display. And because we were able to do that, instead of finding 6 locations, they set about looking for locations that would partner with us just to put these things out on their counters or where people could just reach them. And our goal was to, and let me back up and say this, because we are what's called a federally qualified health center, we come into everything with the mindset that our regulators require all of our locations to provide the same services everywhere. So what's available to one location has to be available at the other 2 locations. And if we get a 4th location, if and when, that one will have to do the same. And because we serve people in numerous counties, that has been, it's what our federal agency requires of us, but it's also not friendly to some of the grants that we've applied for that want to be very localized, because we have the mindset of providing the same thing everywhere we go. But a public health vending machine was different because it's not depriving any patient of anything. It's putting a product out there. So this seemed to work out well. We even, with the funds that we got, we even had some that we would take to Main Street Fest or to county fairs and everything. And we found over time that a lot of teachers and police officers and firemen and first responders would say, I want to keep that in my car along with my first aid kit. And so the stigma of having access to Narcan was gradually going away. But when we first placed one in a laundromat in Hartsville, which is not county, I know that, but it attracted Nick Barris to come out there and do a story about it because it was so rare. So when we started out, there weren't really that many people to collaborate with. There are other agencies. We had worked, Hope, before I worked there, before Freddie worked there, Hope had worked with a gentleman named, I think, Jesse Smith, who was out of Robertson County, was a road specialist, regional overdose prevention
prevention specialist at one time. So we had just started developing a network of locations based on where they were, based on the type of, based on a high at-risk population in that area. But we also chose places that had 24/7 access, like the laundromat on South Water, or as close to 24/7 as you can get, like at the Exxon on Airport Road. Places where people can go and they can discreetly grab a box without people judging them or noticing, or they can just say, not be judged. When we first started out, there were when Darius did that story, they were in sheriff's departments and probation offices. Well, I used to be a public defender. None of my clients are the right time to go to probation office to get a market. Like, not really. So we tried to place them in judgment-free zones and places that were open late and on weekends and holidays, because overdoses don't wait for office hours. And we do work with the Prevention Coalition, and we have evolved, as I said, in how we distribute it and where we distribute it. But the other issue that we have run into is that we are mandated to serve a rural population, and to date we have not tried to go into places like Hendersonville. We're in Westmoreland. We have a mobile health unit that goes to Portland and to Lafayette, Hartsville, and other places to take health care out to the rural areas. That's been our mandate so then that's been our mindset. So I'm sitting here thinking, I didn't know Hendersonville had those restrictions, So when we do try to grow, and I do think we will grow because we're on a growth trajectory, that's what we're doing. So what we are running into this year is we have like 10 locations in the Gallatin and Portland target zone. We also have 3 more in Sumner County, Westmoreland, in our lobby, and our main office, one at Rockbridge Market and Bethpage, and then one at Fall State. But we've got, I think, 2 in Hartsville now. The laundromat owner asked us to move it out of there, but we have one at Bubba's Market and another place. And I think we've still got one at a laundromat in Lafayette. But we have, we talked this over because this grant is very specific about the target areas. And Freddie has developed, he said, I'm going to color code the ones that are purchased with these and store them separately to make sure that these boxes only go in the locations here in Gallatin or in Portland in our target zone. But we tried before the Cycle 1 state grant expired at the end of June to stock up what we could to try to keep the outlying areas stocked throughout the next year until we can find funding. Our whole purpose, this is the first time we've ever applied for a grant with Sumner County, and our whole purpose is to try to help us bridge the gap until we are eligible, and if we are approved for Cycle 3. If we are not approved for Cycle 3, then it's just to keep the product out there for as long as we can, because it does make lives. We know it does. We finally, and I think Josh referred to this, the numbers are slowly but surely beginning to reflect a decrease in overdose deaths in the state of Tennessee since the whole opioid thing, all of us partnering together and working together has made the numbers start to go down. These are results. We know that they work. I do not have, and I apologize for how tiny those are, but never have divided them into two slides a page if I had known how small some of those print would be, and I didn't resend that. But I do know one of the questions I believe that you raised was how much of our state money did we spend and what did we spend it on? We spent it on, for the medical supplies, which is the Narcan and the fentanyl testers and the Dispose-Rx. The budget that our CFO gave me did not line up with the invoices, but the invoices that I looked at today said that we spent $197,000 on Narcan, $13,000 and something on fentanyl tester kits, and another $2,000 on Dispose-Rx for our pharmacy to dispense to people to do away with the leftover opioid drugs. That particular grant also covered things that we are not applying for this grant. we are only asking for coverage if it was purchased Narcan, small. About a 70-30% of Narcan versus the fentanyl test strips, and then a little bit for travel, because the cost of gas is on so much and it has so many locations. However, we've also, since we submitted our application, have come up with a solution for that, which is 2 of us who live in Gallatin are going to split the locations here, and we're going to stop. And he's going to continue to stop the Hartsville. So we're not going to have to use as much travel even as we could in our application. Our capital was. So we're always evolving, things are always changing based on your feedback, positive, and this is what I'm saying, we're adaptable. We're very adaptable. We're going to start working with Joyce Craig, who is the regional overdose prevention specialist. She's bringing training, and you have questions, sir?
I do. No, it's okay. Are you redoing your presentation?
Not quite.
Go ahead.
Right.
You got something to finish it up?
No, we're good. I was just going to say we're straightforward, simply asking for money to help us bridge the gap in stocking our distribution locations. No salaries, nothing else, just a straight product.
Okay, so how much did you guys seek last year? And
We've never applied here.
Oh, you haven't?
No.
So this is your first time?
This is our first time
Okay.
applying with Sumner County.
And you're seeking 75, right?
Okay, and I have 2 questions, and the first one is not for Hope. I need clarification from Will and some guidance, please. Since you're the most familiar with the surrounding counties, right now they're looking to supply 2,640 boxes in Sumner County. Compared to other counties, is that a good number, or is that over the amount that you normally see in a county being distributed?
I mean, you gotta think of the counties we're surrounded by too, right? Smaller, Hartsville's rural, I mean, population 16,000, right? Versus Sumner County. Yeah, not even that, right?
Compared to Rutherford,
Yeah, I mean,
Montgomery, maybe?
Yeah, like Wilson County at the fair, we've got right at 1 million kids on handout, just in 10 days.
Wow.
Yeah.
1 million.
I think Hartsville, the Trousdale County,
So, I mean,
donated to $10,000.
I think it's,
Total countywide.
I think it's a conservative number when you think about what it is.
The whole building.
The question I would ask, and I can say this at the end of the meeting too, I know that there's been a couple presentations that have asked for fentanyl test strips. I know that doesn't align now with federal government's guidelines. Are we able to fund those?
We are still able to fund those because it falls under Exhibit E and what we agreed to in the settlement before the federal guidelines have changed, because we're still locked underneath that settlement.
Okay.
So that is still allowed. The question I have for you is, during the presentation, Cycle 1, you stated that you received funds from the state. The grant is now over, and you were able to take some of the remaining funds to buy naloxone for the surrounding vicinities
Before it expired.
before it expired. So you did not invest in Sumner County, is what I am understanding, and therefore you're banking on us to fund Sumner County? Or were you able to take any funds and actually put it towards Sumner County?
Well, 3 of our locations are in Sumner County, where Hartsville has 2 and they have 1. I mean, so those are outside the zone, is what I'm trying to say. Those outside of the target zone for Gallatin and Portland, there are still Sumner County residents benefiting from that.
So they're in
Including our lobby.
Macon County and they're in Hartsville. This is Walmart County, so Sumner, Macon, and Hartsville is Trousdale County. So we did the remaining funds go to Macon and Trousdale County.
Well, it would probably, as far as, it would be divided equally between the sites that we have. And as I said, 3 of the sites outside the target zone are still in Sumner County. There's one at Ball State, there's one at Rock Ridge Market, there's one in Westmoreland. None of those are in the target date of the application. Within,
But the state fund itself that you were awarded, you stated that it was in the outlying areas. So none of those funds at the state, when the state grant ended, came to Sumner County.
well, they're still coming. They're coming to the sites that are in Sumner County, yes.
But you didn't buy any naloxone for those sites.
Yes.
You did, even though you said it was only for the outlying areas.
That would be for the bridge if we were funding. That's only in the event that we are funded. But we have been stocking all of these places
So
with the state funds.
you're asking us to supplement just our area, even though you received funds in those county funds are now going to other counties, is what I'm hearing.
We're trying to make sure nobody has to, we don't have to remove a box. So our hope is that if you can help us with the area that you were wanting the money to be spent in, that even Sumner County continues to benefit in the sites that they are, but again, our focus when we started this out, because was to try to make it available to our service area. We weren't trying to shortchange anyone. We were trying to reach our service area. But, 2 years ago, things were different. So.
I got a question on your point, though. Can you stay on this point for a second? That's what I'm going to do.
That's right, go ahead.
Yeah, I want to ask you something, too. Stay on this point, though. Go ahead.
Well, I guess I was reading where it seems like that your target area is a mandate as a federally qualified health center to provide health care to medically underserved populations, i.e. rural northern Sumner County. I know that our target areas are Portland, down to Gallatin, or 109, kind of that corridor down to Hendersonville, those hotspots, right? That's currently that's what we're focusing on this grant cycle.
Big extra points.
Yeah.
For those, that's what I'm saying. For those, that's kind of what's in my brain when we do this, is that, so.
And that's talking about all of our services, our
Yeah, sure, but it sounds like you're specifically, it says our mandate is like it's for underserved, so obviously it wouldn't necessarily cover hotspot areas such as Hendersonville or Portland that are more, where we're having issues with Gallatin down that corridor. I guess I'm just talking about what we're giving, but I guess as a state organization with $500,000, I guess that you guys have not spent as a state, and knowing that you're funding Trousdale County and Macon counties, I see where in here you guys have said that you would only use Sumner County opioid point funds or sites within the designated target areas. I guess I'm not sure where those target areas is. I guess when you say target areas, from what you guys are identifying, it's different than what this committee is identifying.
No, it's in the packet. She has the target areas right here.
They're all within Sumner County.
It's all She has.
Well, I'm not talking about within Sumner County. I know she identified Westmoreland. I'm talking about like within our target area, that corridor that the instructions we were given of the hotspot.
Yes, these are our target. Portland, Gallatin.
These are our locations. Here's one, here two outside, and then Rock. This and then our side of this one. And this is our Portland locations.
Okay.
These are in the corridor. And we have been supplying those since we expanded. It's been gradually over the course of.
I guess the only thing that stuck out to me differently in this particular program was that you guys also got state opioid funds. I didn't hear where anybody else was getting state opioid funds, correct me if I'm wrong. And it's outside of the target area. Other counties are being served as well as not just I know it could come around outside of Sumner County as well throughout the state. How I guess would you say you ensure this money only goes to supply these kits at locations within the target areas of Sumner County? How would you guys do that with? You say store them separately, track them separately. I guess is that pretty?
If we know it's he's going to have the ones that go to these specific sites within, and this is another adjustment we've made even since the application process was I didn't realize that one was out of the zone, and that's our lobby, or the office where I work. So we will designate that funds to be used for the target areas, but there are still some Sumner County locations that are not in these.
Right. So
and what I'm trying to do is what I'm saying we're going to try to do is try not to deprive with our funding for cycle 1. Anyone who received cycle 1 was not eligible to apply for cycle 2. Cycle 1 ended at the end of June.
Right.
We are trying to ensure that people don't have to go without until we get approved again, and if we don't get approved again, at least they would have it for a little bit longer.
Right.
Because everybody whose life is saved, just like that guy whose daughter wrote a sticky note, or you're giving somebody a chance to live. And you know what? I would love it if we can hand out free EpiPens and insulin, but that's not really funny.
Right.
We have this opportunity.
So
Our job is to save the lives of the state.
So the 75,000 you're requesting, and in this big packet we have here, where we have Hendersonville, we have Portland, we have Gallatin. The monoxide that the money that the 75,000 you get, you're gonna spend just for that, and then that will be separate from all your other locations, like Charles got everywhere.
Exactly.
It'll be labeled different, and in those 3 locations, I know you have other machines in Sumner County currently that you got funded from wherever, and you still build Sumner County without us giving you money.
We tried to build a backlog before.
So you were already providing to Sumner County before you got funding from Sumner County.
Try to. Yeah.
Right, and now you wanna
We're just
do more in Sumner County with the funding and hit these hot spots.
We're trying to make sure it doesn't run out before if we get approved.
Right.
And if we don't get approved, then it won't.
And if you get approved though, all the you purchase with
start next July.
right, you wouldn't take it to Wilson County and supply their machines.
No.
Okay.
But I will say this, because we've talked about this, depending on how well the supplies last. If we exhausted the funds for the target areas, the 75,000,
Right.
and we had leftovers from the state, we would happily bring that into the target area. Right. That's not an issue. It's not an issue bringing state money into Sumner County. We just
Right. Because you're already supplying Sumner County now without the money.
correct.
Okay.
For as long as we can. But if we've got a whole year without funding, we were just trying to stretch it. Does that make sense?
Thank you.
So, I'm gonna ask Dustin, did answers to these 2 questions satisfy your concerns that were brought up? Restate your concerns then.
My concern is the state gave Hope, and we're just gonna say $100. They spent $75, and there was 25 left on the table. That was supposed to be earmarked for us, Macon, and Charles County. Based upon her statement, that $25 went to go buy naloxone, and it's gonna go to the other counties, and we will miss out on that portion. That was supposed to be earmarked for us as well. So instead of separating that $25 between the 3 counties, the other 2 counties will get that $25, and we're now having to fund what the state was supposed to give us.
Is that a true statement, or can you explain more
How
about
do they
that?
pay for the
What I'm
non-fund that they have?
There are 3 Sumner County sites not in the target zone that would still be serviced by the other ones that are not part of this grant. And there are only 2 sites in Hartsville and 1 in Macon. So proportion-wise, I would say it's about a third each.
Yeah, I mean, the machine's still in Sumner County, it's just not in our so-called target zone.
Or hot zone.
But they are hot zone.
Like I said,
Yeah,
Rockford
but I mean,
Market in
the
Bedford,
money's, still
the
from
West
Sumner
Morgan
County.
office and Ball State
Yeah.
are all outside of the target area.
Right.
But it's still Sumner County.
It's still Sumner County.
Right.
So,
So.
You met the obligation of the state, yeah.
Three
So-
states,
so
3
Dustin-
locations, which is more than
so
one.
Dustin, so what I'm hearing from Will and Matt and her is that, and correct me if I'm wrong, is that some sites within Sumner County were getting served with that extra $25, but the hot zone wasn't. Do you agree with that? And do you agree with that?
And all, yes, and all this
Is that
is
still a problem?
future. This is how we're trying to work it out in the future, so that we don't violate your request that the money stay where you asked for it to stay. But we're trying to not leave people in other places in the lurch, but some of those other places are still in Sumner County, they're just not in the target zone.
Right.
So you had $500,000
So this request
from the
will
state,
go
and you
towards
spent,
those hot
looks like
spots,
around
but the previous one did.
$250,000, something
No, we were, this is interesting. I gave you a link there. We were
No, it
over
wasn't there.
around $900,000
was using some
over
kind of-
years, and
These
we
are
spent
machines are supplied.
around
There is a big machine
$5,000.
that's.
Okay, time out. There's a lot of crosstalk going on here. I don't know if you asked the question or she's still answering the previous question. Okay. No, I want her to answer that question because I want to hear it, but this question that I asked is still going on, and I want that worked out too. So finish with her, and I want to hear it, and then Ms.
You had
Chairman.
$900,000, you spent $500,000 where, that was where that.
If you can't read it, and I apologize for that, but on page 6 of the PowerPoint, it's in tiny print, and I can read it to all of you.
In the green?
Yeah, this is the one where I was saying our CFO gave me the total that's in the chart, and the invoices that I looked at today did not were actually for more than what's in the chart. But basically, we spent $197 on Narcan, $197,000, a little less on, well, that's not what you're asking. You're asking about one. If you go to the link that I sent, from what I can tell, everyone on that list did not, there was one place that came within $54 of spending all their money, and most every other recipient of the 501 grant spent from a third to two-thirds, but nobody hit the amount they were awarded, except for that one that came within.
Okay, well, my question is, if you had that much money, did you spend a bulk of it in Sumner County, or did you spend a bulk of it in Macon and Crowdville County?
Well, that particular grant was structured much different from this one. It covered percentages of people's salaries. It covered equipment for the purchasing of the vending machines and the boxes. So I don't know the exact breakdown. It wasn't just for the
subsidized for certain things.
right. That grant looked different. It funded things that we're not asking for this, like so.
So, Madam Chairman, Will was saying something different than what Dustin was saying. I want to hear them explain that out. So, your understanding,
What I said.
For clarification, can you just state where your location's in Sumner County, not our hotspot, because that come out here recently. I understand how the state grant, that was a 3-year, 2.5 year ago project, right? So, I mean, we didn't have a hotspot, so-called, then it was the county. So if you don't mind just stating for the clarity of the board where the locations are in Sumner County.
But not the ones in
Just Sumner County.
The three that I know are outlined are our Westmoreland Hope Family Health Lobby, which was the first vending machine we set up. I don't know if it's the small cabinet or the countertop, but there's one at Rockbridge Market in Bethpage on Highway 30 going north. And there was one last I heard at Ball State. Freddie was concerned about that one because it was not high usage of what he wants to do. We're not looking for additional locations, but if one is low use, he may try to find one to replace that location.
Correct.
So we're not looking at adding locations until we feel secure about our funding. But those as of right now are the ones that I know about.
Correct. So explain,
outside the hot zone.
so you and he have a difference of opinions. I want to understand, I would fully understand.
Well, he's saying
You
that,
seem to be okay with it, he doesn't. So
yeah, he's saying a certain portion of the state opioid grant, again, that was written 2.5 years ago, had to go in Sumner County, and it did. That's what I'm trying to say.
It went to those other 3 spots, and what's your problem with that?
My spot is not that. My problem is we're dealing with Sumner County funds. They have now.
Okay.
The state funds also funded Hartsville, Trousdale, and Macon counties. So if there were funds left over, we'll say $15 to make the math easy. And there were funds left over to buy naloxone, you expect maybe $5 in Macon, $5 for Sumner, and $5 for Hartsville, Trousdale. What I'm trying to make sure is that $5 still remains in Sumner County, and that we are adding to that pot. What I don't want to happen is our $5 gets split to $250 for Macon, $250 for Hartsville, Trousdale. We have zero, and now we're having to fund Sumner County when we should have gotten some money.
Are you okay with that, what he said?
I mean, we're really getting in gray area right here that, honestly, again, Hope wrote a 3-year grant 2.5 years ago. So anybody that writes a grant like that naturally is going to step down on year 3. So that $500,000 probably, that was a 2-year project. Okay, so yeah.
And
it's not going to be the same amount each year. It's going to dwindle down. So, I mean, we'd have to look at that.
Divided equally between the 3 counties is what his concern is.
But it all goes back on the side. I mean, we're talking about a separate proposal. It all goes back to how that proposal was written. And she even stated, because I was involved on that project, I'll be honest, it covered salaries. She's not asking for any salaries in here. Vending machines, she even stated in the proposal they're going to a lesser, affordable cost vending machine where, again, the proposal that is in question shouldn't even be in question. Because, I mean, number one, it was written through a different organization, right? And it was written kind of totally different than what this proposal that she submitted to us for.
But if there was leftover money, why wasn't it spent somewhere is the question.
Everyone who applied had leftover
County you have?
So like 108, however many, 50 people that applied. I was looking on the website and I have provided the link in the presentation. No one spent all of their awarded money. There was one organization that got, that's $54 away from hitting it, but there were some people that didn't spend anything.
But even with what you were awarded, you did spend money in Sumner County.
Oh, most of it in Sumner County.
Fulfilled 3 machines.
We have, the hotspot has like 10 spots in it. We got the Exxon on there.
So what are the
You've got
choice?
Shalom Zone and Recovery Church.
Are you saying it wasn't a choice to exclude, it was just, you just couldn't spend it all? What a choice to exclude something?
Yeah, no.
Okay.
You have to give.
No, 13
just
out of 16 spots are in Sumner County.
Okay.
So,
Yeah, I mean, that's.
10 of them in the hotspot, 3.
Does that alleviate?
Okay, that's what I was gonna ask.
I never wrote this one down.
So you got 13 machines
Not machines, the boxes or cabinets or whatever.
in Sumner County. And
It's in the application, it's not in the.
and 10 of them are in the hot spots.
Yeah.
3 are outside the hot
Correct.
spots. And then you've
But
got,
still in Sumner County.
and then you've got 3 locations combined in Trousdale and Macon.
Correct.
Okay. Well,
So my final question, and we're gonna have to wrap this up, because we got another group coming in. The remaining money that was from what you had left, did that have to be returned to the state?
It did.
You got, so it was returned, you don't have that?
We do not.
Thank you.
And that contract expired at June 30th, and we were not eligible to apply for cycle 2. We have applied for cycle 3. If that is approved, it will begin next July 1st.
Thank you very much.
Thank you.
And I think, recovery.
One more thing. Because we have stickers on the bottom of everything. One of the accommodations we really can make is to increase to have more than just our phone number. But this has got Hope Family Health in our main line where people can call for.
And but the Gallatin one, or the Sumner County ones, they'll have different label, or it'll say Sumner County, or, okay.
This main number services all 3 of our locations.
Okay, sound good. Thank you.
All right. So what I did here, if you're looking at is, all the sources from last year that you see a shoe did, or different counties that we did this exact same stuff. That way you can see the impact that it has. Y'all ready? My name is Troy Sanderson. I'm the founder and CEO of Post Recovery. Thank you guys for having me here this evening. I'm here to speak on behalf of Post Recovery for our proposal of missing level care. Our request is pretty straightforward. We are requesting $73,700 to provide 11 Sumner County residents with access to intensive treatment, supportive housing, and recovery services. But what we're really asking you guys to invest in is something much bigger, a continuity of care. Individuals with opioid use disorder don't always need just one service. Many of these people are leaving incarceration, detoxification, homelessness, or unsafe living environments, needing intensive clinical care, but also needing a safe place to sleep. They may need transportation, peer support. They may need assistance with accessing medication for opioid use disorder. And most importantly, they need someone making sure that they don't fall through the gaps between one service and the next. The SMART initiative and the local stakeholders have identified gaps in access to partial hospitalization programs or PHP level of treatment here in Sumner County, particularly for the uninsured and underinsured here in Sumner County. They've also identified barriers such as transportation, housing instability, excessive involvement, and insufficient recovery support infrastructure. This level of care is designed to address those barriers together rather than in isolation. Under this proposal, 11 Sumner County
PHP level treatment sessions and up to 5 weeks of supporting housing while they're attending those sessions. That treatment will include evidence-based and evidence-informed approaches such as CBT, motivational interviewing, seeking safety, ASM-informed assessments, peer recovery support, case management, and medication management for those who need it. Participants will also receive overdose prevention, education, naloxone access, transportation, and individualized recovery planning. So this isn't simply paying for treatment sessions. It's also paying for housing. It's paying for meals while they're there. It's paying for the continued assistance once they complete those study sessions. It's creating a bridge from instability into treatment, and from treatment into long-term recovery. We also want to be clear that Sumner County will not be carrying this project by itself. Us Recovery is going to bring significant organizational resources to this project. We will provide in-kind staffing, transportation, administrative oversight, case management, peer recovery support, workforce development, recovery infrastructure, and housing coordination. We're also discounting this PHP treatment rate from our regular rate of $400 a day to $190 a day, which is a 52% discount. We'll also provide 5 weeks of supporting housing at $200 a week. This will include the meals and the transportation for the duration of the program. We believe that demonstrates our commitment to being a partner with Sumner County, not simply a recipient of settlement dollars. We want to partner with you guys to help your most vulnerable population. We understand that opioid settlement funds must produce measurable results and outcomes. That's why this project has very specific deliverables. We will track enrollment, treatment participation, we will track PHP completion, we will track housing stability, we will track and document people who receive overdose prevention and naloxone education. We will track access to medication for opioid use disorder when clinically indicated. And before someone completes our program, we will develop an individualized continuing care plan and work to establish confirmed handoffs to appropriate services. As you can see on the paper that I gave you, those are the exact things that we tracked in the last year when we served 36 people from Rutherford County. The goal is not simply to say we served 11 people here. The goal is to demonstrate what happens to those 11 people that we serve. Where are they at the future? What came of the investment that Sumner County made? Now, 11 may sound like a small number, and it is. But this proposal is initially designed around intensive services for individuals with significant needs. With a request of $73,700, the county invests an average of $6,700 per participant. For that investment, each participant will receive 30 PHP levels of sessions of treatment, 5 weeks of supported housing, all the meals and transportation, peer recovery support, care coordination, overdose prevention services, workforce support, and transition planning. These are individuals who may otherwise be cycling between homelessness, incarceration, emergency services, detoxification, or relapse. Success for either one of these people will mean a person gaining housing, staying engaged in treatment, returning to employment, and ultimately it's an overdose that won't happen. Most recovery believes recovery is strongest in treatment, housing, peer support, and community resources work together. That's why this missing level of care is designed, that's what it's designed to accomplish. The request of $73,700 to give 11 Sumner County residents an opportunity to move from crisis and instability into structured treatment, safe housing, and sustainable pathway towards long-term recovery. We aren't asking you guys to build an entirely new system. What we're asking is for you guys to help us close the gap in the system that already exists. We're prepared to contribute to provide the accountable for the investment. I want to thank you for your consideration and for your stewardship of these funds. Does anybody have any questions for me about it? I'm sure there will.
Oh, you're requesting 73,000?
Yes,
and
sir.
what is that 73,000 for?
So it is $6,700 per person. That's going to provide 30 PhD sessions, 5 weeks of housing, transportation, and meals.
All right, and that's all in Sumner County, because I was looking through on y'all's.
No, we are building a location here. What we found is, because I got the same question when I was in Rutherford County, sometimes people would do better if you could change your location a little bit.
Yeah.
So, my men would be at our wellness farm, which is right down the road from Cumberland Heights main campus. So we move them out there for 5 weeks. Sometimes they will stay longer, sometimes up to 6 months afterwards, because we do have a back to work program. I'm sorry, guys, I got diabetes in my mouth, so. So, yeah, anybody else want it? It'd be great. I didn't bring it with me. It's okay. That's why I kept getting up and leaving. It was going to be warm. But anyway, they would stay at our farm, and that's where we do a lot of the treatment at, is there on the farm. We do a lot of experiential stuff, hiking, we do some equine therapy, goat therapy, fishing, we do garden table food.
Right. But, because I was looking at, I was seeing Ashland, Cheatham County is
yes, sir,
your business license and all that stuff, and your tax return Ashland City.
Yes, sir.
But the money will only be used for Sumner County.
Only for Sumner County.
And is there a way to track that?
Yes, sir, there is. Okay. It's all tracked through our EMR. Every single patient that we have come through is tagged with the zip code that they come from.
Okay.
It's something important that we have to keep up with anyway, just because of other grants that we work off of and stuff. Yes, sir.
I mean, this is something, but to piggyback on that, you said you're building a facility right now in Sumner?
So we are. We're opening a women's detox and residential just down the road here in
Near Cumberland Heights?
No, not near Cumberland Heights. I'm not sure where you guys are here. It's on K Road.
The farm that they have, their camp is near Cumberland Heights, but the detox center is here.
Okay. Yeah, that'd be a different level of care. So
Is it already built?
It's built. We're just doing, I got about a week left on sprinkler systems, and then I can come to see you guys at zone.
So will this grant be to bring, it's for women?
No, this will be for men and women who are uninsured.
Will this money be spent for people to be there, or split between your other facilities too?
No, they will just be going to the facility in Ashland City, yes, sir.
Okay.
Yeah.
But if Sumner County people taken to a different location,
They will.
they do better possibly.
And that's what the transportation is for, to get them from here to there.
Yeah, so we'll put them in recovery housing. We have high quality, certified recovery housing out there. So we have one in Sumner County now, it's about to open, but these will be in Cheatham County.
So you really don't have anything in Sumner County ready available yet, as far as housing and.
No. Well, so what I found is, if I house you down the road from your drug dealing, I'm gonna have a hard time getting you clean for the next 30 days.
Oh, yeah.
If I take you out of your environment for about 5 weeks, and I get you stabilized, and then I bring you back, you tend to do a lot better.
Well, I 100% agree with that. I know a lot of people that's in recovery, and they go to Florida, and they stay in Florida, because if they come back, I mean, I have an aunt that's a heroin addict, and every time she comes back to Murfreesboro, she gets back on heroin. So I 100% agree with what you're saying. My only concern is, as long as the money.
No, it would only.
Like, it comes,
So we've done
if you pick them up in Sumner County, and it's a Sumner County resident, I'm fine with that. I don't.
And we've got good, just like I said, we've received over $600,000 from Rutherford County so far.
Yeah.
To treat people each year, and we've been very successful at keeping up. Like if you notice on there, we only serve 36 people. That's just Rutherford County. So that's why I brought this, so you can see that we're pretty good at making sure our county stays separated. It's something that we want to track anyway, because we want to know what our impact is.
So this whole page, this is all Rutherford County.
Yes, sir.
And then you'll have one, if you were to get the grant and you start getting people from Sumner County,
you'll
You'd
have
have
your
one
own
of these,
page
yeah.
for Sumner County. And I would only track the 11 people on here that we served this year.
You already have 11 people in the queue to do that?
No, ma'am, not yet.
That's your anticipation of that?
Well, that's what it's paid for. So
Yeah, because it's 60,
it's
6,700 per person, so.
That's 5 weeks of housing, 30 sessions of PhD. I think our ladies who come from Heights can take us a pretty good discount there.
Okay. Anybody else have questions?
Yes, I have a question non-related to this grant, but I need understanding from your standpoint.
Yes, sir.
So you're applying for these funds. I'm just kind of curious why you didn't apply for capital dollars to finish out the house of where you're building in Sumner County, or trying to enhance that house. I'm just curious for somebody that's going to so budgeting grants next year.
I might come see you next year. I don't know if there's an option, to be honest with you.
I just wanted to ask.
I'm gonna be honest, at 40 grand for the sprinkler system kind of hurts.
Yeah.
How long do you had Hustle Recovery?
So I started Hustle Recovery, honestly, by accident on May the 1st of 2020.
Okay.
I was in early recovery myself, about 7 or 8 months clean. I just got out of rehab and was in the process of putting my life back together when a friend of mine passed. That's how it goes. His mother called me that morning, told me, I did what a lot of us do when we get in our feelings. I jumped on Facebook. I don't suggest it. You might end up running a recovery program. I put a post up that basically said, look, man, if you're struggling with this, you don't have to die. There are people out here who will help you. I knew that because a lot of people I didn't know, some strangers had helped me. And then I just put my phone number out there and I said, look, man, if you need help, you don't know what to find, call me. Honestly, I had absolutely no clue what I would do if someone called me. The next morning, the post had been shared hundreds of times. I got 6 calls that day, all the same people I'd never met in my life that said, hey man, I've seen this post. It says you can get people in rehab. I remember looking at my phone and going, oh God, where did I say that? I was thinking I could take you to a 12-step meeting and we could go to church. I have no clue. I barely got myself in rehab. I did not have insurance at the time, so I ended up going on a grant, kind of like what you guys are providing to do an outpatient thing in South Arkansas, where I'm originally from, as well as born and raised. I got here from college in the early 2000s. But to date, I've put over 8,000 people in treatment. Through putting people in treatment and doing that, I started finding gaps in the system.
You said South Arkansas?
Yes,
you know
sir.
Jimmy?
I know Jimmy McGill very well.
Yeah.
He's
a good dude.
Me and him were recently in Washington, D.C. together.
Yeah.
Mighty Birds. So.
Awesome.
Yeah. But through doing that work, I started finding gaps in the system. People kept coming back to me who I got into treatment. And my first question, of course, was, what did you do when you got out of treatment? Well, I went back to mom and dad's and their years. I went back to the abuse support program. I went back to the homeless camp. So actually, me and this guy sitting back here, we opened our first sober living house over in Antioch, Tennessee for 10 guys. The first 14 months wasn't real successful. I think maybe 3 people stayed clean. Everybody owed us rent money. It was really a nightmare. Me and him had lunch one day, and we sat down and we talked about it, and I said, you know, I don't feel like what we're doing is working. We need something. We need to figure out something different. And his suggestion was, why don't we go back to our roots? I said, oh, I don't understand what you mean. And he said, well, what is Hustle at its root? We're an organization that knocks down barriers to recovery. If you don't know who to call, you call us, we make the calls for you. If you don't have a ride to get there, we're on the way. If you don't have shoes on your feet, I'm going to put them there. I said, okay, well, what are these guys' barriers in early recovery? And as a joke, he said, the first thing they need is a job so they can pay the rent, because we were struggling. And I said, okay, well, let's slow down and see what that looks like. What does that take? What are the barriers? Well, first you need to know how to ask for a job. You need to have a ride back and forth to work. You probably need some PPE. You need some programming. So our answer to that was I started a staffing company called Sober and Saline Enterprises that in the last 2 years put 265 people back into the workforce with good paying jobs. That turned into a 6-month vocational rehabilitation program. And then about 3 years ago, I walked into a board meeting because we're a nonprofit and I have a board of people I have to answer to. And I said, hey man, we got 3,500 people in the treatment as of today. And my CFO today, Ms. Valerie Kim, said, that's awesome. Realize you gave other treatment centers $35 million and you could have done it yourself? I was like, no, that's what I never thought of that. So I reached out to my LADAC supervisor at the time. I was under supervision to be a licensed therapist, and her name is Ms. Sumner. She actually worked over there with these guys for about 30 years, and she actually left there and came to work for me to help me put this together. And then Dr. Stephen Ward stepped in and became a medical director. So, I don't know. I just feel like God kind of put me in a place that he wanted me. And he said, look, man, you can either spend a long time in prison for your drug activities, next 24 years, or you can spend 24 years helping my kids. I think I'll go over and help your kids. I don't do jail very well. So that's what we do today. We've grown by leaps and bounds over the last 6 years. Like I said, we were able to open the outpatient, and it became very successful. We'll be getting our JCO accreditation in November, which is no small feat. We were able to start the first respite housing program in the state of Tennessee. We were funded a little over $8.3 million by the state on a 3-year grant, which has nothing to do with this program, but it allows us to put respite housing across the state of Tennessee. So now we have locations in Jackson, we have locations in Nashville, we have locations out in Kingsport, and that's basically just a crisis care model of, hey man, I need help. Okay, I'll be there to get you in a minute. We don't have to ask what insurance you have, none of those things. We're just on the way. And you got to play that
Jackson?
Yes, sir.
That's a tough place.
It is, and I've got the most amazing team you've ever seen down there. They've got hearts way bigger than mine. I've been blessed to have 82 employees today, and also recovery, and 81 of those people are all lived experience. Every one of us are in recovery, except for Cam2, and she's as crazy as the rest of us. But yeah, I would love to invite you guys, if you ever get out of our way, to come by our wellness farm. It is the most serene, beautiful place you've ever seen.
What's the address?
It is 1601 Sands Creek Road.
1601? Sands Creek, you said Sands Creek Road. Sands Creek Road.
Does anybody have any questions? No? Thank you.
You're very, very welcome.
What town's that in?
Nashville.
Nashville?
West Nashville, right? No, it's Ashland City.
Ashland City.
Oh, I thought Cumberland Heights was
Okay.
West Nashville.
Yeah, we've got Highland cows and goats, big garden.
I like Highland cows.
And they all work.
Yeah, they're all working to the program. So, I don't know if you've ever heard of goat therapy. It's probably some of the most fun you've ever had. Goats are the coolest animals in the world.
Thank you.
Huh? Yeah.
So between now and the 21st, you all are to store the applications independently. After the 21st, after the 21st and 25th, you need to give me your scores so I can combine everybody's scores together in one sheet, and then I'll draw the line for the meeting for the 26th.
No question.
Yes.
I had that application question tonight. It's like 360,000 between the ones that were present tonight. Are we to consider the ones that weren't present tonight? Are they automatically disqualified?
So if you were to look at your applications, what I will say is at this point in time, when the applications were actually posted, everybody was made aware of the states, and the only one that provided asked for an exception was Brave Haven Recovery. Those in not attendance were not there. So my recommendation now is to score those that were not here,
And then what happens is, and what Will, Matt, and Mary can tell you is, when it comes time for the applications, we announce each application, and if there's an issue with one, I will be reading that issue out loud, and you all vote to whether or not to accept that application. If you decide to accept that application, then it goes into the score, and then we look at it together. If you all deny that application, we say it was denied because the application did not meet the criteria that was outlined, including
A, B, or C.
A, B, or C.
So there's 200,000 roughly shortfall, correct, on everybody that applied. Is there anybody that is disregarded that that's going to help us with? And then, not that we have to give out all the money for all of it, but we can give out all the money for all those. So where's that 200,000 line with anybody that's been disregarded for failure to do one thing or another? Or is everybody worthy of scoring at this point?
You just said Bravehaven Recovery didn't show up, but Bravehaven asked for an extension or something?
Bravehaven Recovery asked because they cannot have anybody in attendance to have a handout. You all were courtesy copied on that email, and so.
But Recovery Refuge did not.
Recovery Refuge did not, and
their application wasn't complete.
And correct, their application was correct.
Yeah, they were missing their financials too.
So are you suggesting to scratch them immediately? Like,
what I will say is, when it comes time for the 26th, we have to accept or decline those as a group.
Score them.
Yes.
Okay, that's all.
So if you decide to give nothing but zeros for those that were not in attendance or were incomplete, then that is up to you. But as a group, we'll have to decide on the 26th whether or not to accept them and the scores that were provided.
But on your off time, go ahead and score it, but score it how you think you should score it, but if it's incomplete, it's incomplete, just.
We need to address.
I didn't know if he was directing.
Any, any conflict of interest. If you are on any of these, entities on the board, if you are on their board or serve on, work for them, or serve on the board, please don't score them.
Or have made donations.
And don't do that. You have a,
He actually announced that at the beginning.
Oh, I wasn't here.
So I won't let you know. It's good to reiterate, but I want to know.
Hey, I had to stay in the building. I couldn't leave. They had me captured. So, yeah,
That may be done now on the 26th.
Major deal.
On your sheets.
On the sheets.
On the sheets, just write on it, because at the beginning of the meeting, I said I did not put a statement on there to say I have to do it, so you just write it on the sheet.
Well,
Don't be putting that on there just where you ain't got to score on that.
I want to thank everyone for coming. I want to thank everybody for their wonderful presentations. I also would like to say, and I may wait until our last meeting, I'll probably wait till our last meeting. I have something I want to say about our community program.
This is hard.
It is hard. It's probably harder than any committee I've known.
Absolutely.
It's just, we've done a fantastic job, and we are considered the best program in the Middle Tennessee, so we want to keep it that way. But I'll tell you some things at the last meeting, but if you have any questions, please reach out to Dustin or myself. I'll try to answer it, but
I make a motion to adjourn.
Second.